Hi, my name is Amy Lin, and I am the Acting Director for USAID Center for Innovation and Impact, or CII, in the Global Health Bureau. I took on that role in December of 2019, and 1 month later, I was looking forward to what 2020 would bring. I was just taking on this new position. I had just recruited a number of new team members, and I had just joined the WomenLift leadership cohort. 2 months later, in March of 2020, I was no longer looking forward to what the year would bring. I and my team were suddenly in unexpected full-time telework. I was trying to juggle and entertain and educate my 6-year-old, who I had thought was going to be in school, but instead was at home with me while I was trying to telework. And I had been asked to take on a leadership role in the agency's COVID-19 task force. So I was besieged with constant taskers and urgent needs, and just didn't see how I could have the time to devote to WomenLift. So I almost withdrew. But instead, I decided to make my WomenLift leadership project a project that I also saw at work, which was to chart my team strategy for optimizing innovation in global health. That's a big ambition, and it wasn't clear to me where to start. So I began by asking a few questions. What would my team need in order to optimize innovation in global health? Who could we partner with? And what might be in it for them? And what also would they have at risk if they were to pursue innovative approaches? And what could I do to change myself in terms of building out my own leadership capabilities and venturing out of my safety zone so that I could experiment and grow? I decided, in trying to answer those three questions, to build three things: build my team, build trust, and build a portfolio. For building my CII team, I looked at fostering a collaborative, supportive, and fun environment, despite the fact that we were only communicating through our computer screens and were only facing a lot of stressors that we normally didn't in a typical year. We also elevated diversity, equity, and inclusion as a key priority and revisited our recruiting practices and called that out as a core team value to be more diverse and equitable and inclusive, creating a safe space for honest conversations and also trying to build trust within the team. But I also wanted to extend that trust and relationship building beyond the CII team. How could we find potential partners who may not have innovation in their job title or in their official portfolio, but where it would make sense for aligned goals and shared interests? And with that approach, my team partnered with the President's Malaria Initiative to launch a $30 million innovative financing initiative that allowed health facilities in sub-Saharan Africa to stay open despite COVID-19. We worked with the Office of HIV to help support partner countries in how they would pursue digital health initiatives. And so we tried to act on our relationships and partnership building to actually move innovative approaches forward. And then I tried to think about the overall portfolio and how to make sure that it was diversified, that we were investing in short-term projects with immediate results and also long-term projects with those that would require more time to bear fruit. We were working on COVID activities as well as those that would affect other life-threatening diseases. And we were thinking about transformative, radical approaches as well as incremental improvements. And so we assessed over 500 innovators who could quickly respond to COVID and also continue to support maternal and child health innovators that we knew would make a difference. But not everything worked out. We had 3 big bets at the beginning of this year of 2021, and not one of those 3 big initiatives is moving. We ran into constraints that we couldn't overcome, and we've had to pivot to other opportunities that felt more feasible for right now. And I think that was also a learning to recognize when we need to pause and pivot, and that our intention and ideas alone are not enough. So what next? I know that with COVID-19, the challenges facing global health are extreme and unprecedented, and we will still need bold and new ideas to confront them. So I think this strategy matters more than ever. We still need to figure out how to optimize innovation in global health. And to do that, I intend to continue investing in building my team, building trust, and building a portfolio. I also recognize that this strategy is going to be a work in progress. It's not a polished, finished endpoint, and it's more of a guide to help make decisions and trade-offs and ask questions to make sure that I'm intentional about how we spend our time and our money. I also recognize that I am a work in progress and will continue to make missteps, but also can hopefully learn from those missteps as I go forward and continue to try to be an ever more capable leader in charting this team strategy to optimize innovation. So I'm really glad I stayed with WomenLift, and I'm immensely grateful for all of the support and the just-in-time leadership boost that they provided. And I look forward to being a very active alum as I take forward the next iteration of this team strategy. Thank you.